Stoptober was basically the Department of Health in 2012 put together a programme to try and get people to stop smoking as a whole nationwide event, and basically it's in October, 28 days of not smoking, and then the people are 5 times more likely to quit completely. And last year there was like 250,000 people took part, so it was very successful. Right, smoking can affect your oral health in a number of ways, from very basic things, from staining and build-up of calculus getting stained, so aesthetically your smile might be affected. Then you've got things like oral cancer, you're at high risk. Things such as your sense of taste is affected by smoking. If you have any cosmetic work, long term you may get some recession there, so it doesn't look as appealing. If you have a surgical treatment, then you're more prone to getting infections and having post-operative pain. Definitely every 3 to 6 months, because it does put you at high risk of more severe gum disease, which can lead to tooth loss. So the quicker this is detected, the more treatable it is, but it must also bear in mind that if you do have the more severe gum disease, you're going to get it more rapidly, more aggressively, and it's very, very difficult to keep on top of and stabilise. Yes, you are more at risk of mouth cancer. Last year 1,900 people were diagnosed with mouth cancer, and out of those people, sort of 70 to 100% of those will have been smokers in the past, so you're definitely at high risk. And if you introduce alcohol into that, the risk is even greater. And dental treatments that can be affected is pretty much all of them. So we can start from whitening, where you're going to have more staining, so the effects are not going to look as nice for as long. Then you go for things like periodontal treatment, which is the severe gum disease. That's not going to be as effective as a non-smoker. Then if you're looking at wanting a beautiful smile with implants, if you go for implants, you've got a higher risk of those failing and not working correctly. If you go for crowns, bridges, veneers, things like that, if you have the more severe gum disease and the gums recedes, then the appearance will not look very nice. You're going to see what was known as long in the tooth. So if you have a tooth extracted, you can lose the blood clot, and if you're a smoker that doesn't form as well, and so that can form a dry socket, which is incredibly painful, and any surgical procedure you're not going to get the healing that is desirable.